This video includes an overview of the entire ASC Solution package and detailed setup instruction for the clear access table base, supine platform and pad or flat top, and multi-directional arm boards. This setup is typically used for lateral spine surgery procedures and lateral interventional pain management procedures. The Clear Access Spine Surgery Table by OR Safety was developed to maintain all of the utility of competitive spine tables that are generically referred to as Jackson tables, while removing all of the notable drawbacks of those types of systems. The table maintains head-to-toe C-arm access for lateral, anterior, and posterior spine procedures and can support the simultaneous use of two C-arms. While maintaining such unrestricted C-arm access and providing target site radiolucency, the Clear Access table has a safe working load of 600 pounds and has a noticeably more stable operating surface, particularly for heavier patients. Without outboard wheels, the table allows shoulder-to-shoulder docking with the gurney, which facilitates safe patient transfer onto and off of the operating platform. Finally, and perhaps most notably, there are no towers at the head or foot end, completely removing the need for T-pins and allowing anesthesia direct access to the patient's head and airway. Notice that without outboard wheels and towers, the Clear Access table has a dramatically smaller footprint than the competitive systems. A small footprint has been shown to be a significant benefit in the increasingly crowded ORs, hallways, and storage areas of most facilities. Specifically, Jackson-style tables commonly occupy more than 26 square feet of space, while the Clear Access footprint is less than 12 square feet. Importantly, the Clear Access table is the only spine table on the market that has 3 preset configurations, each configuration organized in response to customer feedback and intended to deliver the right amount of equipment to fit specific types of clinical practices. The ASC Solution is configured to support practices dedicated to outpatient spine procedures and interventional pain management. The new standard is configured for hospital-based spine practices and can support anterior, posterior, and lateral spine procedures. The neurocervical configuration supports practices that include brain surgery and posterior cervical procedures requiring cranial stabilization. In this video, we'll highlight the Ambulatory Surgery Center Solution configuration, otherwise known as the Clear Access ASC Solution. This is the simplest configuration of the Clear Access table, and it includes the Clear Access table base, the supine platform or flat top with comfort pad, the standalone flex frame, and multi-directional arm boards. Let's review the correct setup of the supine platform and arm boards for use during lateral procedures. Move the Clear Access table to the preferred location in the OR. To lock the table to the floor, press any button on the hand controller to wake it. Both hand controllers will auto-sleep if inactive for 30 seconds. Press any button to reactivate, and then lock the table by pressing the wheels button firmly once and releasing. You'll note an audible beep as the table is lowered to the ground, warning caregivers to keep personnel and equipment clear of the table. Next, install the supine platform or flat top onto the table. To do this, bring the supine platform over the table and lower carefully into the cradle. Once the supine platform is completely seated, depress both thumb releases at each end of the table to collapse the handles into the platform. Collapsing the handle at the foot end locks the supine platform into the base. To install a Clear Access arm board, bring the arm board in at an angle that is superior to the side rail to engage the top of the side rail first with the arm board lock. Lower the arm board to engage the bottom of the side rail. If necessary, slide the arm board toward the head or foot end before locking the arm board onto the side rail. Lock the arm board onto the side rail by firmly hand-tightening the locking mechanism hanging from the bottom of the arm board lock. Once the arm board has been attached to the side rail, it's possible to arrange the arm board in an unlimited number of positions by supporting the arm board with one hand while moving the elbow of the arm board to a desired location. For lateral procedures, it's advisable to place one arm board approximately parallel to the surface of the supine pad to support the patient's lower arm. Once satisfied with the location of the arm board, lock the arm board in place by hand-tightening the large black knob at the elbow. Verify that the arm board is secure, then repeat with the second arm board. The second arm board will be attached on the same side as the first arm board, following the same installation steps. Placement of the second arm board will be higher to comfortably support the patient's upper arm. Once satisfied with the location of the arm board, lock the arm board in place by hand-tightening the large black knob at the elbow. Once the patient has been positioned on the table, use patient restraint straps to secure the patient to the table before draping and preparation for surgery. Adjust the arm boards as necessary for patient comfort and to minimize the risk of pressure marks on the patient. Please refer to the Clear Access Instructions for Use with any further questions.